but very few people are willing to be real with you and telling you what it takes to actually get to where you want to be.
It is rewarding. I feel like when you help somebody, not only you're making that person happy, but I think it's like comfort food.
We're watering down our healthcare by lowering the bar. We should be trying to build each other up, graduate more hygienists if we need them, or more dentists if we need them, put incentives for rural areas.
Welcome to the Real Talk of the Dental Chair, everybody. My name is Ima Steffi, your host, and today we have an amazing dentist with us, and his name is Dr. Josh Sanchez, a dentist who is not only passionate about patient care, but also about creating unity between dental professionals. Because let's face it, dental hygienists, assistants, and office staff, we're all working towards the same goal, but sometimes it feels like we are on different teams. Today, we're going to break that down for you. Just to give you like a little short story of how Dr. Sanchez and I met, we are two people that spend way too much time in social media, you guys.
Probably.
And we are both very vocal too. We like to comment on each other's posts. But you know what? There is a lot of good points that we bring in from the perspective of our different professions. And most of the points we do agree. There is some other points that we don't see quite eye to eye. But one of the things that we always do is that we do respect each other's comments. We do respect each other's perspective because we both have something to bring to the table. And I'm hoping that we can break all that down for you today. Doctor, do you want to say something about you?
I just want to say that I'm happy to be here too. We definitely do agree on a lot of things. I think there's a lot of things that need to be said in the dental field. And I think there's a lot of things that we need to put out there and consider. Because if we don't, then it's just going to fester. It's going to turn into animosity. Even within dental assistants, within hygienists, we're all on the same side. I think that's the main point I want to get at. I mean, even within a bigger scheme, our political system here in the US, we're all American. We're all on the same side. We all have to live in this country together. We just
Yeah.
have to find a way to do it together. You're right. You hit it around the head. Unity is what we need. And I think discussing these points, bringing out our problems, and finding solutions forward is the best way forward.
I agree. I think that having discussions and talking about it is the only way that we're going to find a solution.
Absolutely. Very inflammatory people on TikTok, and TikTok is not the best source of news anyways, but
It is.
it is a good source of content of, but yeah,
Yeah.
there are some people out there that say this is my way or the highway and that's it. And I can think of a few dentists, a few hygienists out there.
But
that.
it's a good way to learn what not to do.
Absolutely.
So tell me, what is one misconception that patients usually have about dentists?
Oh man, misconception. I don't know if it's earned or not, but we're the most terrifying doctor out there. I think one people think is that one thing I always see is that people think we're just killing it, that we're all wealthy. I'm first generation college. I'm first generation doctor. I built this practice from nothing. My wife and I built this literally from the ground up on a handshake from my old boss. He sold the practice inside this building he owns to me. After work, I came here and put the floorboards down over 5 paychecks. I paid for these floors. I put them down. I did never did that before. I had to. I had no money. I had a newborn and my wife, and we bought a trailer. We lived in it. We made it work. We saved our pennies. We put things into this practice, and we just started fixing it, painting it, everything ourselves. There was a point in time in my career 2 years ago where our trailer got destroyed in these floods that happened in California, and
Oh,
my wife, baby, and I lived in an air mattress in this room in the back office for 6 months. We were essentially homeless. People come at, they have an idea of like dentists and what people go through. Everybody goes through struggles. Like I said, I'm first generation. I had to make it work. My wife and I struggled, and we now have like a full staff. But at the time, I was working 7 days a week between 3 jobs. And here I wasn't getting paid. Here was just a dream. So people should know is that like this perception that we're all wealthy. I drive a 15-year-old car. Money is a concern to everybody, man. For every level, there's another devil. I guess that's one way to show it. I always love sharing my story. I go to Western U, my alma mater, every year. I share my story. I share my struggles because everybody shows success. Everybody on Facebook tells you everything's great. They're always on vacation, all this stuff. But very few people are willing to be real with you and telling you what it takes to actually get to where you want to be. I love sharing my story, and it means a lot to me because I'm not ashamed of it. I struggled, and you know what? I'm proud of what we built. I have a practice that's thriving. We have a good reputation in the community, and the same building that we used as refuge, when we needed it here with the air mattress, we bought that building 2 weeks ago. So I'm now the owner of this building, and it's immensely proud for me as the first doctor in my family, the first business owner, and just moving it forward. Just seeing what's possible by just taking one more step. Like yourself, I know you've told me you're a business owner too. You have a lot of things going on, and just as well as anybody else what it takes and how much struggle it is to put in and how much work.
Step by step, day by day. I mean, things don't happen overnight. And I feel like when you have a dream and you just have to go for it, and it's not going to happen overnight. It's going to be a lot of struggles along the way. And you're going to be probably the last one that gets paid, right? Because you have employees and
Mhm.
your practice, bills, and
Mhm.
so, because that happens to me too,
Yep.
right? The last one that sees the paycheck, if you see the paycheck.
If you see the paycheck is the real thing. Everybody thinks when you own a business, you are rich as hell, and that can be further from the truth. You
Not
earn it over equity, over time, and hopefully it turns into something. That's really what you're building. It's been an interesting journey for sure. And someday I'll probably post like a full journey with pictures of what it took to get this place up and kind of share that. But like I said, the biggest reason I'm able to do this is my wife is very supportive. Obviously, she saw potential in both of us. She's my office manager. Our team here, because I know the whole point of this conversation we wanted was to talk about unity. My staff here, we go out on a limb for each other. We really care for each other, and we're like siblings. I'm a younger doctor. My assistants are Gen Z. I'm a millennial, so we're always clowning on each other, and it's a lighthearted place. I really wanted my office to be like that. I treat them with respect. If they're sick, I tell them, "Hey, I'll make it work. I'll move with schedule around whatever we got to do. Take care of yourself." We always want to make sure we take care of our staff. And if you show genuinely that you care about your staff and you enjoy and love what you do, it's infectious. It's as infectious as any disease out there. If you care about what you're doing, other people will care about what they're doing.
your story is very inspiring. You have your family, your wife is there working with you, which is great. So you guys have one or two kids? Two?
We have three. I have a stepdaughter who's 17. I have a one that just turned 2, and then one that'll be 4 in February. I got all girls in my household. So
So what do you do with the kids when you guys are working?
So my wife only comes here 2 days a week. We have my mom watch them on Wednesdays. We have a babysitter on Thursdays. Like everybody else, nothing's perfect. You gotta make it work. And the time that she comes in, it's all business. She's helping get in the paperwork, anything that needs to get done in that respect. And she's a big help. She also does some stuff from home, but with the kids crawling on her, it's a little harder.
That is impressive. That is a very, very inspiring
She's
story.
a she's a tough woman, man. She grew up in Fiji, so she's from the Fiji Islands, and she's always just been a go-getter. She comes from very humble beginnings herself, and she's probably my biggest support. Her and the kids are why I wake up every day and do this. Because man, some days you don't want to do this.
And
And
I think that when you have children, it kind of change your whole perspective of life in general, right?
absolutely,
It's
absolutely,
like it's
you
nothing that
you're
you
never too tired.
no.
When
You
you
would do
got diapers and bottles to pay for, you get up and you figure it out.
yes, you do. I don't know. I hear a lot of young people say, "No, I cannot have kids because the economy," and there's always excuses, right? But if you wait to the right time to have babies, that time will never come because you're
Absolutely,
always going to have something going on in your life that is going to take precedence. So, but the moment that the baby comes, that is the time because you make it happen.
absolutely.
Tell us like a funny story or something memorable that make you think, "Yeah, this is why I do what I do."
I think every day you can probably find that in the patients you treat. There's some gratitude. I also work at a nonprofit on Fridays called Dentistry for Vets. It's in Marina. It's a low cost nonprofit aiming to take care of veterans, obviously at low cost, probably about 30% of what private practice fees are for treatment. So it makes it more affordable. Obviously, if there's homeless veterans, we just take care of them. There's just it's a great program. I'm really proud to be a part of it. It'll be my 4-year anniversary in October of being a part of that program. And even though I have my own private office, I love going there. It kind of fills my soul and my spirit. When you see people come in who are struggling and you're able to get them back and able to get them out of pain and get them happy, and really their self-esteem comes up because you gave them teeth. That's always a great feeling. I can there's I got a voicemail I should probably send you from one of my patients. He's a cool guy. You'd have to meet him. He's actually the one who gave me a knife. I don't know if you saw my TikTok where he pulled out a knife in the chair and he gifted it to me. But he's a cool guy. He sent me a voice message saying that, and he's wheelchair bound. He's a veteran, Vietnam vet, and he told me now girls are interested in him and all this stuff. I'm like, hell yeah. But he was just profusely thanking me, and I got that voicemail on my cell phone, and it meant a lot to me. But I can think of many patients like that who just make it all worthwhile, and it's just why we do what we do. You know, we're focusing on their health first, obviously, but then we're able to take care of them and make them feel like their needs are met.
It is rewarding. I feel like when you help somebody, not only you're making that person happy, but I think it's like comfort food for your
I
soul.
think so. And as far as like hygiene too, getting the patient cleaned up, getting them and educating them about their oral health and coaching them and seeing the improvements, that's gratifying. For the first 2 years of my office, I did all my own hygiene. When I was an associate doctor after COVID, nobody was really hiring doctors. So I did a lot of hygiene. I got pretty damn good at the scalers. I still, from time to time, will ask my hygienist to come check my work. I have a lot of humility. I want to become better in everything I do, from a prophy to a root canal.
Yeah.
I mean, that's important to have, but it's part of a whole team. And I think having that collaborative team where we're working together, we're on the same page, and we align together to get the patient in health, and they understand why their gums and their bone and everything's connected to their teeth, and it makes it run better.
Yeah. And I think that what you just say is very important. Your hygienist came and kind of checked your work to kind of guide you a little bit. And the reason why is because when you are in dentistry, even though dentists and hygienists, we work in the same building, but our paths are a little different because your path is more towards restorations and treating like hard tissues, right? Yours is more like soft tissues, right? Like gum disease, and we concentrate on other things. So
Yeah.
that's really nice of you. It's very humble, and I love that. Why can't we
Yeah.
just be honest about our capabilities, you know?
I think we need to understand our limitations, and that we're not all perfect in everything. There may be an SRP that maybe is a hygienist or I miss, but if we hold each other, like help each other, not like to check each other to be mean or spiteful, but because we honestly want to help the patient, that works. And the way I see hygienists and dentists, dentists are restorative, hygienists can be preventative, and with the SRPs be restorative as well, but we're two sides to the same coin, which is why I keep saying that splitting up our fields, saying, and I know a lot of hygienists want to have their own clinics. I have a feeling if we go that way, we're going to divide our power. We're going to be setting ourselves up for failure, because eventually private equity is going to buy that up, and they're going to treat hygienists the same way they're treating dentists right now in these big corporations. And they're going to continue diminishing our voices until our voices are not heard and we're powerless to do anything about it.
Especially in California, right? That you have hygienists that actually have their own practice too. But but one of the things is that I feel like if we keep diminishing us our professions, whether it's hygiene, whether it is dentistry. I read an article that one of the people that I follow in TikTok that is
Right.
also a dentist, and he also have a podcast, and he has a magazine out there and everything, right? So he was actually reading an article that talked about some dentists. I don't remember exactly where right now. I think it might have been in California,
Mm.
that they will train the assistants to do restorations, and they will do better restorations that would they would the only problem that I see with that is that you kind of lose a little bit of credibility in front of the patient. When an assistant is doing your job, then it makes the patient think probably less of you. Say, well, why do I need to go to the dentist when, you know, the assistant is doing my restoration anyway, right?
Sure, and that goes both ways too. They're trying to do assistants who can do scaling. That's a
Yes,
huge thing in the field for hygiene right now, and
yes,
why more hygienists need to get involved with the hygiene societies. They need to put their voices out there, and they need to come together. Dentists too. We need to come together, both of our professions, and
yeah,
stop fighting each other. A lot of dentists think like, oh, if my assistant's going to scale, I can pay them less than a hygienist, and I don't need a hygienist. That is the wrong way to think. We're watering down our healthcare by lowering the bar. We should be trying to build each other up, graduate more hygienists if we need them, or more dentists if we need them, put incentives for rural areas if we need to do that. But lowering the bar constantly to the point that care is going to be different between communities, where the people who can afford quality care and good work are going to go one way, and then people who are just going to can't afford anything are going to get lesser care. That's just
yes.
terrible.
Doctor, from your perspective, what can hygienists do to build stronger bridges with dentists and vice versa?
Great question, and one that I think needs to be asked more. Because a lot of times inside our fields, it seems that hygienists and doctors aren't on the same page, and that leads to some confusion and miscommunication and anger. One thing I think a hygienist could do to improve that relationship with the doctor and the practice is understand the business side of dentistry, understand the reimbursement rates, and then ask. One thing I did when my hygienist started with us, she asked for a crazy number, far larger than what I could get from insurance. At that point, what's the point? Yeah, even being in business, I can do some things myself. But I opened up the books. I showed her, "This is what I get from insurance," and she was appalled. She was like, "What?" Like, people somehow think that all these dentists and are just, like, getting crazy amounts of money, and to be honest, overhead is so crazy, it's not like it was and maybe never will be again. We have a landscape that we're trying to navigate, especially younger dentists like myself trying to make it, and once I showed her what it takes to run the practice, we agreed on a number that was good for both of us, and then we agreed to bonuses where she could hit some of those if she did assisted hygiene. Now, assisted hygiene is we're not stacking people side to side. It's more like diagonal. There's like an hour here and an hour here. So extras and stuff are done before she even comes in the room. And then assistant who has a polishing certificate will polish. But we all work together as a team. And it's not like a crazy amount of patients either. It's realistic and they get bonuses on this, so they like it. And it kind of helps the day go along, but it also helps us keep the office open because when you run a dental office, I never imagined how expensive that would be, and it is crazy expensive. But once I was open to showing the numbers and getting them on board with that, everybody just bought into the system. I always tell her it's like we're the hunters and we bring back food to feed the rest of the village. The front desk, the assistants, they all have to be fed as well. So we provide for the village. And it really resonated with her. So that was one way we did that.
I agree that it would be better to do that. But I have a question for you. Like when you say that you do assisting hygiene, how do you stagger? Do you do like half an hour patients? Is that how you do it?
If you think of two columns next to each other, you wouldn't have both patients come in at the same time. You would have the
Right.
hygienist, yeah, you'd have the hygienist start on one patient, and then the next patient will come in 30 minutes later. And then by the time they're done scaling that one patient and, talking to them over hygiene, they're ready for the next patient to do the same thing. And on the front end of that, the assistants took x-rays and then assistant after will polish. And we go over their work too. I mean, we all trust each other to do work and they're trained well. And that's how we get through patients. And a lot of offices are
Yeah,
adopting that model because if you're going to accept insurance, and insurance means that you're seeing teachers, you're seeing people who are working, hardworking people, and if you drop insurances, you're gonna lose a lot of those patients and they're gonna go to corporate dental offices who are possibly not really focused on their care as much as we do. I like seeing those type of patients. I don't wanna just see patients who just want veneers and high-end stuff and focus on that stuff. I want to be a family practice dentist and see the kids, see everybody. So it's really important for me. I don't like the reimbursement rates for insurance, but there's other ways I'm going about doing that. I'm part of CDA. I'm part of my local dental society. I'm advocating, I'm pushing, and I'm reaching out, asking questions. I think that's the most important way to do that.
for sure. I have done hygiene assisting before. I've done it a couple times. I done it with a dentist that I will do side to side. Side to side was kind of hard because then you don't have any time at all for
Notes.
writing your notes. you at least do half an hour slack. I think that gives you a little bit more time to write down your notes at the end.
Yeah, we make it very doable. And if my hygienist ever said like, "Hey, this is a bit much," or "I don't feel good today," we can cancel patients, put things aside. And it's she has control over what she wants to do. It's fine in my practice. It helps us out a little bit more, and then obviously the bonuses help her out more. So everybody kind of wins in that model. But as long as it's with mutual respect, understanding, trust, and then we're all working towards the same goal, which is keeping the lights on in this place.
I agree. It has to be mutual communication and be eager to help and being part of the same team. How can we better educate dental students and hygiene students to see each other as collaborators and not competitors?
That's a great question. There's a few things that are coming up in the woodworks. They're gonna make that more difficult, and I think it's by design. One of the things that I see coming in the dental field, I'm always trying to anticipate where it's going because it's changing quite fast. We have to be on the same page. What I would tell dental students, dental assisting students, or hygiene students is to really understand what private practices are doing right now and corporate. Learn everything. Learn the landscape. Learn what you're getting yourself into. It's more of a way that if you understand what's going on, you can make better choices. But as far as what I would advise them to do, just shadow. I mean, there's not really much you can do for a collaboration until you're in it. But just getting, like I said, getting understanding is the best way to go about it. Better understand how things work in a dental practice. Then some of the hardships that are challenging right now is that I think in Nevada they have assistants able to scale. That's gonna be a huge issue, and some dentists here in California are pushing for that. And there's a hygiene shortage, and a lot of hygienists have been pushing for much higher rates, even far more than some doctors are making here in California. And they're, taking advantage of the shortage, supply and demand. Of course, it's a free market society, but that has pushing towards allowing dental assistants to scale, and it really will diminish the quality of care. I believe that will be. The more education you have towards something, the more you understand something, the better job you can do about it. There's also hygienists who are starting their own hygiene clinics. It was meant in California to help patients who can't afford care, don't have access to care. But in my hometown, there's a hygiene clinic that opened up recently, and I looked at their page. I was curious about it, and I see some of the prices for SRPs, cleanings with no doctor in there, just the hygienist with a AP certificate, and the prices they're charging are more than what private practices charge in cash, not taking insurance. I just feel it's disingenuous to why the degree was made in the first place. I'm all for free market and for advocating for business owners, but I feel it's taken advantage of what was meant to help a problem. And now it seems to be in direct competition with dental practices. And the more we divide ourselves, say if a dentist and a hygienist have separate offices, guess who's going to love that the most? Not the hygienists, because corporate and private equity will do the same thing they're doing to dental offices. They will diminish the value of hygienists. They will make giant corporate hygiene offices, and they'll do it far better than we can because they can do it cheaper, they can do it faster, and they have more opportunities, more incentives, more money. And guess who's going to end up losing out on this? The patients. So the more divided we split ourselves in the dental field, the worse off it's going to be for everybody. And I firmly believe that. I know there's a lot of hygienists who are pursuing that certification and might want to open up their own shops. But unless it's in the middle of nowhere with no dentists around, I don't think it's really helping the issue because that one is near where I'm at, and this is one of the most expensive areas to live in the U.S. So it's kind of interesting. I don't live here, but I practice here.
Definitely, it is complicated. I don't know if we are in a point of not return because so many things happening. They want to give the right to assistance to scale, like you say, without an education. Dentists to come and do the same thing, take the hygienist
Sure.
jobs. What is going to happen is that it's going to create a bigger problem that it is because I hear already these dental hygiene students and people that they're asking on social media,
Yeah.
should I go towards hygiene or should I go towards nursing? What should I do? Because they see what is happening and they're concerned that they're not going to have a job. So that is a legitimate concern. They graduate from college, they have these huge loans too, and now what are they going to do? I
Yeah.
just think that this is a situation that it doesn't help anybody.
Yeah. What we need to do at the end of the day, we need to address the shortage by creating more hygienists and doing it the right way, just making more seats available.
More programs, do some kind of incentive. Like, for example, right? If maybe have dentists actually helping them financially with the loans or do for I don't know.
We're $500,000 in debt ourselves. That's a hard ask.
Oh, yeah,
And proportionately, the amount of money we make proportionately to the loans, we're probably 4 times more screwed than a hygienist. Yeah.
I don't know, but for them to have some incentive.
There should be more programs that if you go help underserved communities for a few years after graduation, maybe your loan should be absolved. I think that would be a great way for dentists and hygienists to get them one experience so they come back to the population they and home they want with experience. And then two, it helps with the loans. And three, it'll help everybody who is underserved, get adequate care. So
I usually think that that is a good idea because I was discussing this the other day with another one of my guests that we were saying that for the first 2 years after you graduate, any profession really,
yeah.
you really book smart, but you don't have that experience.
Yeah.
I feel that by doing what you're saying, it can give them that practice that they need. It is really a tough situation. I feel like we need to unite and do something about it together, or we're going to lose. I
Absolutely.
mean,
There's no way
in
forward,
all
and
sense.
the people betting against us are not dentists, they're not hygienists, they're not assistants. They're people who have no business being in the health field, and that goes for medicine too. Optometry, pharmacy, all the health professions are being monetized, are being watered down, and are being manipulated. And we're about 30 years behind, maybe 20 years behind medicine, where private practices will not exist. And you're going to have a corporate model, which is where all go to one shop, one big place, and work in like a Walmart, work in a Target or something like that, some retail facility. And that pressure on medicine loses focus on health when all we're focused is on not just paying our bills, but making shareholders who are invested money. It kind of dilutes it and it really skews away from medicine. But who
Yeah.
knows? Maybe I am going to stay in business because honestly, everybody I know that has gone to those corporate places, they have come to our office and let us know all about it. But the fact that they go to those places in the first place, it's
Yeah.
out of desperation
I just
usually.
feel that a lot of dentists are selling to DSO as they are preparing to retire. But then now that office is owned by a DSO. For somebody that
Yeah.
is not a dentist, I have no idea about clinical.
It's
All
happening
they
a
know
lot. They
is
offer more
production.
money. They offer more money to the older doctors, and the older doctors, I don't say they don't care about the profession anymore because somebody's been in the field that long, but maybe they should consider giving a financial break to make it more affordable for a younger dentist to take over their office. 'Cause at the end of the day, it's the service towards their patients that they're really giving away. And yeah, they'll make more money, and there's a lot of hardships right now financially for that generation as well. But it's got to be a way forward. It's got to be a stewardship of our profession. And I don't ever see myself selling out to a corporation. My morals at least go up to 5 million. After that, I don't know. We'll see.
I it depends how much they pay.
Yeah, I'm like, you know what? That patient was never nice to me in the first place. They never flossed when I told them to. So you know what?
Let somebody else deal with it, right?
Yeah,
No,
nah.
but it is a hard situation because I feel like dental offices are not owned by dentists anymore. They're owned by corporations, and corporations
Some
want to
private
make
practice still makes up 80%, 80 to 85% of the practices out there. So we are still a good majority of the practice owners.
well, that's good. That's good to know.
So yeah, it's a good number, but every day it's getting a little smaller.
It is, and that's kind of scary, isn't it? Even for you guys.
Yeah, I think at the end of the day, so maybe someday I'll put up a sign that says privately owned dental
I
practice.
think
I pitched that to the dental society, but then they said I would be alienating those practices that are corporately owned and those dentists. It's you got to be inclusive.
can you put it inside your practice?
No, I can put it outside my practice. I own the building. I could put it on in paint, red paint if I wanted to. See what
Well,
happens.
then, well, then,
Yeah.
I would do it. I think that is important because I don't think that the patients have the best experience when they go to these corporations. because
Definitely
they're
not.
trying to outsell things. I mean, I talk to my neighbors and people that go to these places and they never come back.
And there's a reason for that. You're missing the soul of the practice. When patients come to my practice, I tell them I'm going to be here for the next 30 years. My name is attached to this building. My name is attached to this practice. I want to treat you how I treat my own family. That's when I started my practice. That's what I built it on, with that principle in mind. And if you ever checked out our practice or reviews, like, they're heartfelt, they're honest, they're genuine. And I really appreciate that. I love being that in this community. And as a younger dentist in the community, putting our name out there and building something that has some respect on it, I love that. And also, I'm one of the few Latino dentists in this area. So that's also a source of pride for me. You got Dr. Sanchez right in the middle. So
I
it's
think it's
cool.
great that at your age you already own your own practice and your own building. That is great. Not too many
Yeah.
people do that.
Yeah, I told you what it took to do that. I told you that my wife and
Yeah.
I were essentially homeless in the back, and we built this place up, and I just bought the building about a month ago, and, we did it using equity in our practice and loans, and, just doing it, but now we control our own destiny and, can make it happen. Yeah,
Yeah. That's
thank you.
So, doctor, what would the ideal unified practice would look like to you?
Unified practice. Today, when I started my morning huddle, I did it by really telling everybody that I loved working with them. I told my team that. I looked at each one of them. I said, I love working with you guys. I'm happy we have this practice. You guys know our back's always against it. We're always trying to make it. And I appreciate the hard work you guys put in this practice. And then we all did my office is called Seal Rock. I put our fists in. We said, go Seals. All of us said, go Seals. So a unified practice is showing respect to your staff, showing love, showing appreciation to your staff. Whether you buy them Starbucks once in a while, go bowling, take our staff bowling, stuff like that. It's just building that unified team. We all come, we're all friends. We all work towards the game, same goal of keeping this place open and keeping this place running and building a reputation that we're proud of. And I think my staff bought into that, so I'm proud of that.
It is very important. I heard complaints about hygienists also saying that they work in toxic environments, and that's the reason why they left. If we have a listener that is working in a toxic or divided office, what was that one piece of advice that you will give this person?
I would say you don't have to stay in that situation. You can go somewhere else. Money talk, bullshit walks. So if you don't like the place you're at, somebody down the street is willing to hire you. And if they have the right environment for you, go for it. Not all offices are toxic. When my hygienist was leaving on sick leave, she tried helping us find a new hygienist to fill in her spot in the meantime. She cared that much about the practice and us and worried about us, how we'd be where she's away. She's a young hygienist. She's a year out, so she bought in, but I think, offices do exist. Not every dentist is a jerk. I went to dental school, and yes, there's some of my colleagues and people I've met along the way might not be the most socially adjusted, let's just say that, and, maybe they just didn't get spanked as kids. But some of us do. Some of us come from humble backgrounds, first generation doctors, and we just know how to be. Because my first job wasn't a dentist. I was a Subway sandwich artist. If you worked in customer service in that way, or if you worked in the system before you went to the dental field, you know how it is to be treated a certain way, and you don't ever want to make people feel bad. So I think that's what it comes down to. That's my advice. And I know we're getting closer to the end of the time. So one thing I'll say to everybody in your listeners here in your talk is that stay in it. We need good people in this field. We need people who care about our patients in this field. You may go through hardships from time to time in some offices, but take ownership at every step from assistant to hygienist to doctor. We can take leadership. And that doesn't mean overriding everybody. That means supporting, that means encouraging, that means pushing forward, trying to push to do the right thing, improve things for our patients. And at the end of the day, that's what's going to make the difference. Corporate can do whatever they want. They'll never replicate a good team that cares about their patients. You can't pay somebody enough money to care. They either do or they don't, and it all comes down to attitude. That's one final thing I would say to listeners. And thank you so much for having me on as well. This has been a fun talk. I know we've had some technical difficulties here and there, But I'm glad you're doing this in the field. We need more people speaking about the issues that the dental community faces. And hopefully, with this dialogue, we can move forward, come up with ideas, and get more people interested, engaged, and actively involved in the hygiene societies and the dental societies and just helping each other get through these hard times.
Thank you so much, Dr. Sanchez, for sharing your wisdom and heart with us today.
Man, I got wisdom?
Your wisdom, yes, of course. And unity in dentistry is such an important topic. And I think our listeners will walk away with a lot of reflecting to do. Where can our listeners finding you? I know you're in TikTok,
Just TikTok. I'm not really active on social media. I do TikTok for fun. That's
your
it.
website.
That's where we met. A website, Seal Rock Dental Care at .com. I'm over here in SoCal near Santa Cruz, keeping it, holding it down for everybody. But that's it. I just spend more time with my family and do TikTok for fun when I'm with my staff. That's it.
Absolutely. Well, thank you so much. And for all of you listening, you hear it, just think about it. And let's try to get unified and not separated because we're stronger together, you guys. So thank you so much for listening. And don't forget to subscribe. And we will see you next week for another episode. Thank you. Thank you,
All right.
doctor.
Thank you.